Good morning, everybody. Welcome our webinar series. Today we have a very important topic to discuss and learn. It's about the crisis that we're living, COVID-19. We have a special guest thanks to the sponsorship of Memorial Hospital. So we're gonna welcome our guest and she's gonna be telling us everything that is happening right now with COVID-19. If you have questions, we're here to help. And our guest is going to be also answering all possible questions regarding this crisis.
Welcome. This is Al Otero here with the Global Trade Chamber and our CEO, Maria Rene Davila. As always, we're trying to be ahead of the curve when it comes to challenges, opportunities, and this is no different with this virus, right? This
Absolutely.
is a unique time in history, both for us as business people, but also for people coming here from other countries. They don't know the system in the United States. They don't realize the huge opportunities they have with healthcare in Florida, especially in South Florida. One of our great partners for the Global Trade Chamber is Memorial Hospital. Memorial Healthcare System in South Florida is the fourth largest healthcare system in the country.
In the country.
So that's very impressive. And we have a special guest. I can't believe she took time from what she's doing out in the field to cope with this virus. We're so honored to have Dr. Jennifer Goldman, DO and MBA, Chief Primary Care, Memorial Healthcare System. Welcome, Doctor.
Thank you so much for having me. I will take off some of my protective gear now. Here we go. So important to wear a mask and protection. I am stationed here in the field on the front lines here over at C.B. Smith Park. And I have a place here in our command tent that's very socially distanced from everyone else, so I can take off some of my protective equipment. Thank you so much for having me. Just a note about what's behind me here at C.B. Smith. I am in a tent. We have some South Florida weather. That's how I can describe it, with some rain outside us. So if you hear some background noise, I apologize. The C.B. Smith Park testing site is a collaboration between the governor and Memorial Healthcare System, the National Guard, and the Florida Division of Emergency Management. And so we do have representatives from all of those sites, here today. Thank you so much for having me.
Thank you so much for taking the time. And before we start with some questions regarding COVID-19, Dr. Goldman is also, she's very involved in other activities. I don't know how she makes time to cover all this, but she's also a volunteer president and co-founder of a Primary Care Haiti, which is a non-profit organization. Would you like to share some information about this important cause?
Sure, thank you so much. I think so many physicians actually, because our heart is in the community, we do find the time to volunteer for organizations that really have some wonderful impact in the community. And I've been traveling to Haiti for over 15 years at this point, initially to work in hospitals and help out in clinics. And we recognized that the need was there for continuing medical education for Haiti's physicians and nurses and midwives out in rural Haiti. And so we started this organization in collaboration with our Haitian physician colleagues who live in Haiti. And our goals are to train Haitian physicians, nurses, and midwives in rural Haiti on emergency medicine and response, as well as screening for cancer, specifically cervical cancer screening, as well as bringing ultrasound technology to the field in rural Haiti as a way to bring diagnostic equipment and imaging in an area that really doesn't have. And so we, unfortunately, due to this pandemic, there's no traveling, but what's wonderful to know is that because our work involves training the future generation of physicians, they're able to continue all of that, even though we can't travel down there. And that's ultimately the meaning of what we do. Thank you for asking me about that.
We have a very large Haitian community here in South Florida, so it's really an extension of our local community. So that's why it's so important to have a presence in Haiti. So very good. We appreciate your hard work.
Thank you.
We're going to ask you a few questions that we have been sent through our subscribers. One is, can the virus be spread through food, including restaurants, takeouts, etc.?
That's such a great question. So this virus is in the air in droplets primarily, which is why, you know, staying socially distanced from people 6 feet or more apart, wearing the masks that the mask that I had on at the beginning of the interview, those kinds of things really help prevent the majority of spread from this, including hand washing. When it comes to this virus being prevalent on food and takeout from restaurants, it's very, very low possibility. And so, you know, the recommendations at this point, you know, from the CDC are that, you know, food primarily from restaurants or grocery stores is safe to bring into the home. In fact, many people ask me about whether or not, you know, you need to disinfect the packages or the food, and the issue is that many commercially available disinfectants that actually would kill this virus could do damage to the packaging of the food and could get into the food. And so we, you know, except for wiping down the outsides, you know, spraying with bleach and those kinds of things could actually compromise the packaging integrity and potentially get into the food. And so,
Wow.
yeah. So
Because,
the
you know, we
most
hear all these questions all the time about or you will see in the internet or Facebook, social media telling you about
Yes.
cleaning the food, disinfecting the food, washing the food. So it's going crazy.
It sure is, and I think everyone is really trying to do their best to, you know, to try to prevent this spread. But honestly, the most important techniques are actually the simplest, and that is, you know, hand washing. 20 seconds or more soap and water is the best, and specifically focus on hand washing before you eat and after you eat. That way, anything that touches, you know, your mouth will be with clean hands, and that's the most important thing. And washing your hands throughout the day, teaching our children to wash their hands at all times when they're coming in the house after being outside, and really at any time. And then, of course, you know, this little mask. This is a surgical mask. This is not an N95 mask. But it prevents the majority of the transmission of this virus. Even many cloth masks are fine for this, and just preventing those droplets from, you know, leaving you and going to somebody else is the most important way to prevent this.
Dr. Goldman, with all the different messages that we're getting about the virus, in your opinion, what is the current situation?
So in the world, the cases of this virus are going up. Unfortunately, in the United States, the cases of this virus are going up. In Florida, the cases are going up significantly. And so the state of the virus right now is in a state that is just it's not controlled at this moment. And it's hard to hear that after all these months of, you know, everyone trying their best to socially distance and wear masks, and it can become tiring. But at this point, I urge everyone to not relax their guard. This is not the time to gather in groups of people. It's really not the time to do that. It's not the time to stop wearing, you know, protective gear like masks, because our goal as citizens of this world and this community are to protect each other. And while some of us may not have as many risk factors for developing a very bad course of this disease, meaning getting very ill from this disease, many others can. And it's our responsibility to really help to protect the most vulnerable in our communities.
Right. Can mosquitoes spread the virus? That's one of the questions we
Especially now with the summer.
Yeah, with the summer, a lot of mosquitoes.
Sure, good question. And no, the mosquitoes cannot transmit this virus. This virus is not transmissible through mosquitoes. Certainly in South Florida, we have enough mosquito transmissible viruses and infections that we have to worry about. And so don't let your guard down. It is summertime in South Florida here. And so, you know, wearing mosquito repellent is really important for some other pretty bad infections that can happen, but coronavirus COVID-19 is not transmissible through mosquitoes.
I know you mentioned about wearing the mask and washing hands all the time, but people wants to know why they need to wear a mask. What exactly means the fact that you're going to be wearing the mask? How effective is that?
Absolutely. It's such a great question. And I think that it's really important to understand, what this virus is and, how it spreads. This is a respiratory virus. It mostly affects the lungs. And so whenever we speak, whenever we sneeze, whenever we cough, we actually transmit droplets. It's just part of the things that that we do as human beings, whether you try to or not. If you look under a microscope, when people are talking to each other, there are little droplets that are being passed. And the fact is that this virus is heavily present in those droplets. And what that means is that barriers protect droplets from spreading from my face to your face. And that's as simple as it gets. And that means that, again, wearing this mask like this means that my droplets can't get out of my person. However, if you're not wearing a mask when you're talking to me, your droplets can, in fact, come across, even if you're standing specifically within 6 feet, but there are some reports even slightly more than 6 feet. And then what happens is if your droplets get on my face and then I touch my face, as we all do throughout the day, or I apply lipstick, or I am wearing a mask, I go to take off my mask and eat my food, any of the droplets that you have just transmitted to me could then get on my hands, which I could then spread to my mouth, my eyes, my nose, all these mucous membranes that we have that are open to our bodies, and then I could become sick with the virus. And why is this important? Because this virus is very deadly still. And we do know that, yes, the majority of people who get sick from this will recover. Some people, though, have a prolonged recovery and are ill for quite some time. And others, specifically members of our community who are over age 65, or younger people who have chronic conditions, even like high blood pressure, diabetes, obesity or overweight becomes actually a big risk factor for getting sick with this. And so even if we're not in those risk categories, chances are we know someone in our families, in our communities, in our extended network who is at higher risk. And even if that person is staying home and doing everything they need to do, if we as members of their family or their community are going outside, not protecting ourselves in the way we need to, just a quick visit to that person, children visiting grandparents, or etc., can end up transmitting the virus to somebody who's extremely vulnerable. And we're seeing that every day now.
But what you're saying is so important, because wearing a mask is not only one way, it's two way. So if you are wearing the mask, but the person that is next to you is not, you're still under, the possibility to contain, to receive this virus, right?
From them. Yeah.
So from them. So it's definitely very important to protect yourself, but also make sure that the people that is around you is also, protecting themselves.
That's good.
What is the next question?
What are some of the reports that some of the testing is wrong and people that are tested positive, the test was bad?
That's a very good question. I mean, by and large, these tests are extremely accurate, actually, and a positive test result is extremely sensitive and specific, meaning we're detecting that there is COVID-19 coronavirus in your secretions and that it is specific to the COVID-19 virus and not another coronavirus. I think that what happens with some of these reports that are, in very small numbers is that, there is an extremely high volume of testing going on. And so it is possible in very small cases that there could be an error that's made. But again, by and large, I want to emphasize these tests are extremely accurate. And the nasal swab, the nasopharyngeal swab that goes all the way back, even the anterior nasal swab or the oral pharyngeal swab, these are very accurate ways of detecting this virus, down to even 3 or 4 copies of the virus, in your secretions. And so it's a very powerful way of testing for this, and they're actually very, very accurate. One thing to say though about testing is that the PCR test, which is the type of test that we do through the nose or the mouth, that type of test is a snapshot of the moment in time. And so it means if you're negative, then you're negative today, but it can't predict what could happen to you tomorrow. And so remember that, and the importance of wearing masks and washing your hands, and doing everything you can to protect your community.
I think a key to all this is education, doctor, because we read and hear so much from the media, and unfortunately the media can't really be trusted all the time because they're not really working on the facts always. So this interview is extremely important for the community.
Absolutely. And talking about, the testing, what percentage of people testing positive actually have the symptoms?
It's a very good question. So it's a hard question to answer, depending on the record keeping at the test sites. In fact, that are happening. We do at CB Smith. We make appointments for these tests, and we do ask questions about whether or not someone has symptoms or doesn't have symptoms. The positivity rate in the community is now between 15 and 20%, which is extremely high. Those without symptoms still have a positivity rate approximately 8%, and it could be higher or lower depending on, again, the community being tested. But these are people who identify themselves as not having any symptoms at all, could have been exposed to somebody though who was positive, and then they are testing positive. And so higher percentages of people with symptoms are positive, and that would make sense. But we still see a significant amount of community spread among people who have no symptoms at all. And that's really, I think, at the crux of this, right? Which is why it's such an important question. And that's why I think, even if you don't have any symptoms at all, our obligation as members of the community, to protect small businesses and to protect our clientele and to protect each other and our family members. Our role is to wear the mask and to wash our hands and to show that that's my way of protecting you. Because honestly, as I said, these tests are great tests, but they are a snapshot in time. And tomorrow, if you get exposed and you leave the house not wearing a mask and you bring the virus home to your loved ones, even if you have no symptoms, then it's just, that's how this keeps spreading.
Excellent. Well, why do you think, and this again is from the media, that some other countries have so few cases of the virus now?
So I think that around the world, there are some really great examples of, measures that have taken place to distance people from each other. So social distancing, mask wearing, and hand washing. And I think that, every country's situation has to be, to be taken in context with its own government and set of rules. And to be frank, what its population, is willing to do for the sake of one another. And I think that we have to think long and hard about, again, what do we want for our communities, and how do we protect the most vulnerable among us, and how do we show our friends and neighbors that we're doing everything we can to keep them safe instead of only focusing on ourselves.
It's also a matter of social responsibility, which we don't always have the best here in the United States, unfortunately. Good.
Another question is, do you think we are at the peak of this pandemic?
Oh my goodness, I wish that every single day. I wish that every single day. I mean, here over at CB Smith, we've we've been here out in the field in this tent for the past 4 months. We've tested, over 72,000 people, over 3,500 children at this site. And our Memorial Healthcare System, I know, certainly wishes we were at the peak of this. We have in hospitals around Florida, specifically South Florida, our hospitals really are filling up with patients who have coronavirus, and so more than ever we wish that this would stop. Unfortunately, the data just isn't there yet, and so what we're seeing is that this continues to climb, and associated with that, the more cases you have, there is a percentage of people who will get very sick and need to go to the emergency room. And then unfortunately, there's a percentage of those that will need to be admitted to the hospital, a percentage of those that will need intensive treatment in our intensive care units, and then a portion of those that will end up dying from this. And so the higher the numbers go, the more we can expect that the volume of cases of people who are vulnerable in the community, who are getting very sick from this, will go up. And that unfortunately the mortality rate from this, the number of people who are dying from this, we see climb. Even though the percentage is relatively low, you can't say that to somebody who is part of that 1%, right? If somebody's family member is part of that 1 to 2% of people who die from this, they're not thinking about, the low risk at that point. They're knowing someone who died. And unfortunately, all of us, with our patients that we care for personally, and as well as in our communities and our families, we probably all know people who have become sick from this virus, and we may even know people who died from this virus. And the higher the cases go, the more we can expect that we will know more and more people who have been affected.
Amazing. Looking at another side of this whole epidemic, we see a lot of people that are desperate, that are frustrated, in some cases showing violent behavior because of all the crisis. Because first of all, they've been in the house, some of them for months. They haven't been able to work, so it's creating a whole new set of social problems. And you can see it in the streets. People come on the streets and start doing things because they've been so frustrated and cooked up for so long. What are some of the ways that people can manage with the psychological and emotional things from this virus?
Yeah, I think one of the things, it's a great question, and one of the things that this virus did expose are, the differences in our community, and the benefits that some have versus others. And in healthcare, we call these the social determinants of health. Actually, where you live, who you're surrounded by, are you lonely? And a whole host of other things like housing, availability of food, all of that really impacts somebody and their health status. And in fact, that is probably responsible for about 80% of somebody's health, is actually their social world around them. And I think that this virus, unfortunately, has exposed some of the inequities that have been happening in our society for quite some time. I think that many people, there are some who are quarantined at home, who are lucky enough to have a job and who are able to continue to work, and who, may feel like this virus is not really impacting them and their quality of life and their way of life. But for others, especially others who live in violent households, others who can't escape that reality now, our hearts really go out to everybody at this time of crisis. And I think that how people cope with this, back to your question, really, people tend to rely on their families, their communities, their religions in many cases, and other practices. And so what I say can't always be generalized, but what I'll say is that it's so important to really take stock in the positive things, the things that you have in your life, the people that are around you, and there are many things to be grateful for in this world, and I think that, you know, working to try to incorporate exercise into your daily routine, even if it doesn't mean leaving the house, or even if it doesn't mean going somewhere to exercise, exercising in your neighborhood, or, you know, outside, taking a walk, looking up at the beautiful sky, not now, it's raining, but, you know, normally the beautiful South Florida sky, and, you know, appreciating the just the majesty of the nature out here. I've learned to do a lot more of that as I'm out in the field every day, and just sort of look up and, you know, and really enjoy what we have. And so I think, you know, little moments of gratitude are extremely important for everyone. But, you know, incorporating exercise, eating healthy is such an important thing. And as a family physician, I can actually say this has been wondrous for some of my patients who've really taken to managing their conditions on their own in a way that they hadn't done before, because it's just not possible, let's say, to, you know, to come into the office, and so the visits are over video at this point. And so, you know, they've really taken stock in managing their blood pressure, and that involves taking their medicine every day, but it also involves cooking differently, you know, incorporating less salt, you know, less fat into the foods that they eat. Yeah, and really focusing on fruits and vegetables. There's a lot of really good evidence that can help immune system. Yeah.
I love fruits and vegetables. As you see sometimes at some of the disasters we have seen at schools, they have a whole effort to help the students deal with psychological problems. I believe this is going to be a huge part of the recovery from this, is healthcare systems providing more psychological, emotional treatment and counseling for people after this crisis.
And actually, talking about schools, one of the concerns that parents are dealing, and definitely they don't know what to do yet, is about the next school year that's going to start in August. So what is going to happen with children? Are they in risk? Based on your opinion, your medical and professional opinion, should children go back to school or they should stay home?
Very good questions. I want to address the first one, you know, first if I can, and that is that I agree with you completely that recovery for this is going to take many forms, and that focus on mental health, which has actually, you know, been a focus of late for other reasons, you know, is again back in focus. And one of the things that I'm proud about, you know, with our healthcare system, Memorial Healthcare System, is we really do focus on the community. We are a safety net system, and we focus on caring for everybody. And so much of what we do is outside of our four walls, partnering with agencies in the community to provide for really that mental health counseling that is so important in making sure that adults and children are okay after this, and that they have a place to, you know, to go to or to vent, you know, even if it's virtual visits. It's a way to connect to people. As we know, loneliness is a major determinant of health, and mental illness shortens people's lifespans because they don't, you know, they don't seek the kind of care that they need. And so I'm proud that our healthcare system has so many of these programs that can provide for that. Now, when it comes to schools, it's a very good question, a contentious question at this point, and I know that you know, so many school districts are wrapping their heads around this and trying to decide what to do. What I'll tell you is my medical opinion, and that is, of course, based on scientific evidence and the CDC, and what I'll tell you is, again, how we can stay safe with this, and then children, you know, and their risk for this. So what we know is that children are at risk for contracting the coronavirus. That is what we know. We do know that for the majority of children, you know, the risk to other people from being exposed to those children is high, and in many cases just as high as being exposed to an adult. There have been some conflicting reports of that, I'll recognize, but I think that we need more data on that. And so what I'll say is that thank God, and you know, I'll say that openly, that our children have not borne the brunt of this disease, you know, and in so many cases, you know, around the world, with other viruses, children do bear, you know, the brunt of those diseases, and with this pandemic, children have not. However, there are children who are becoming very ill with this. There are many, many more children in our country who suffer from obesity, from diabetes, even from high blood pressure. And when you have that combination, then it decreases their immune system's ability to fight this infection. And because the percentages of children with those comorbidities are increasing, then there is still a risk that's present for children. But even beyond that, I think that we also have in our country so many grandparents watch grandchildren, right? And I have to thank my mom, you know, publicly for always watching our 3 children. You know, I could definitely not do what I do, you know, if it weren't for the help of my mom. And so we all have to think about that, because remember what we talked about, and how if we don't wear this mask, you know, if we're exposed to others, if we're, you know, inadvertently, non-maliciously, but, you know, forgetting to wash our hands or not wearing a face covering, if grandma or grandpa go to pick up that child from school and that child is exposed, then there is a much higher risk that the grandparents not only will come down with coronavirus, COVID-19, but that they will get much sicker than the children will. And so I think that, you know, we have to all weigh our individual situations when we think about making that decision to return to school. We also have to think about our teachers and their risk, because, you know, many of our teachers have, you know, these chronic conditions that we're talking about that, you know, nobody knows about, and maybe nobody can see outwardly, but it puts them at much higher risk. And so entering the classroom can be risky for them. And so I think that this is a very difficult issue right now, but what I can tell you is, you know, the cases keep rising, you know, in South Florida and in our world at this moment. We do not have a handle on this virus. There are some measures, you know, that everyone can do to protect each other and to protect themselves. But these are individual decisions that have to be based on people's experience and exposure in their households. And the fact is that we cannot only think about the risk to our children, we have to think about the risk to their family members, extended family members, and communities.
Absolutely. Dr. Goldman, give us something positive about the future with this virus, so people can start planning their lives. At least they see hope here.
Yeah. You know, there have been beautiful times, right, over the last 4 months that I think we can look at and say, you know, maybe because of social isolation and quarantining, if we are, you know, if we are lucky enough to have the kind of love and support within our families, maybe many of us have had the opportunity to spend a lot more time with their families and with their children, you know, than they had previously. And that can be stressful, but it can also be wonderful. And so, you know, a silver lining in all of this maybe is to kind of look at, again, what we have, and look around us, and how can we build our communities? You know, how can we spread the word of health in our communities? You know, how do we show each other the kind of compassion, you know, that can sometimes be lacking, and the kind of understanding across many groups that can be lacking? And I know that that's a lofty aspiration, but I do think that something like this tends to put everything in life in perspective.
Yes.
And I think that if we focus on what we can do for our communities and our society at large, and, you know, what kind of society and community do we want for our children, you know, that really can be the silver lining to this.
Yes. Well, this is a unique opportunity for us to get to learn and hear some facts not just media information about a very, very difficult time for the country and for the world. And without information like this from an incredible healthcare system like Memorial, which is one of the top four in the country, and we're blessed to have them in South Florida. I mean, it's just amazing. So we're in the right place at the right time. We want to thank Memorial Healthcare System, and I think there's somebody with us from Memorial, right?
Yeah, we have Maria Alejandra Navas with us.
She's representative. She's helped us put this together,
and also Jennifer, I believe.
And so my experiences at Memorial have been phenomenal because I live in Pembroke Pines. So unique service, very personal care. So I can attest that my whole family goes there, my mother-in-law, and it's because of people like you, and we appreciate you.
Thank you so much, Dr. Goldman, for taking the time to answer all these important questions. I believe that after this interview, people is going to think again about how to manage the day-to-day and how to deal with this virus.
Yes.
The good thing about everything is that we always have hope and things are going to get better. We don't know when, but things are going to get better. So thank you so much again for this
Yes.
wonderful information and interview. Definitely we're going to see you soon.
Thank
Have a
you so
great
much
day.
for having me. Thank you.
All the good work.
Have a great. Thank you
Take
so
care.
much. Have a great day. Bye bye.
Thank you.
Bye-bye.